Number three, C-reactive protein. So this is a special test that is ordered oftentimes when a doctor has run all, or a healthcare practitioner has run all of the basic tests, so starting with your the blood count panel, with your metabolic panel, with your lipid profile, all of those kind of things. Gotten the normal test out of the way, and then still can't figure out what's going on and wants to really dive deeper and start really looking under the hood, so to speak, and getting down into some of the more diagnostic tests. C-reactive protein is a common one for when you have inflammation in the body. And let's just start talking about it. So, C-reactive protein is a marker of inflammation, and it is significantly higher in women who use hormonal contraception. C-reactive protein is made by your liver. It's normal to be made within your body. It's typically made in response to a bacterial threat. So, what this means is when your body identifies a bacteria that shouldn't be there, then it signals your liver to start making C reactive protein. And what signals it is, or what it does is C reactive protein recognizes the phosphatidylcholine residues that are on bacteria cell walls, and it binds to them to help your immune system identify those foreign bacteria and come in, kill them, and move them out of your body. Now, phosphatidylcholine is also free, so it's unbound on the surface of dead or dying cells within your body, because phosphatidylcholine itself is part of cellular membranes. And so C-reactive protein also binds to those cells within your body to help your body clear them. The other thing about phosphatidylcholine is it's common in supplements. It's common in certain foods. For instance, eggs have fairly high levels of phosphatidylcholine. So if you happen to be sensitive to certain foods, and here specifically eggs, this may be an underlying reason for it. The problem with elevated levels of C-reactive protein is that it contributes to inflammation. It increases the risk of a quote unquote cardiovascular event, and it's associated with an increased risk of developing type 2 diabetes. Number four, continuing along this inflammatory path discussion, hormonal contraception increases ANA in serum. What is ANA? ANA stands for anti-nuclear antibody. And this is another common marker that's typically elevated in people with autoimmune conditions. Both CRP, so C-reactive protein, and ANA, anti-nuclear antibodies, are typically elevated in people either with a diagnosed autoimmune condition or who are on the path to developing an autoimmune condition. Hormonal contraception, in here, we're talking progestin-only pills, we're talking combined oral contraceptives, we're talking IUDs, so those intrauterine devices, we're talking depo, so the sub-Q injection. In particular, all of these have been shown in multiple studies to raise ANA levels. Now, lest you believe for a second that intravaginal rings are immune to causing autoimmune problems, do not be fooled by the packaging. In all of these instances, it doesn't matter what the delivery system is. The problem, the root cause, is those synthetic hormones. And if any doctor has ever said that an intrauterine device or an intravaginal ring delivers local bolus of hormones or a local delivery of hormones, they are misleading you. What is happening is that sub-Q, so subcutaneous injection, IUDs, and intravaginal rings all deliver hormones so that they bypass first pass metabolism. And what this means is that they are processed differently by your body. They are still systemically absorbed into your bloodstream, regardless of the delivery route. It doesn't matter whether you are swallowing them or whether you are inserting them into your body, they are making it to your bloodstream. These synthetic hormones are making it to your bloodstream. What is different is that anything that you ingest orally, of course, is going to go through first pass metabolism. And for this, the pharmacokinetics, so that is how fast or how rapidly it's metabolized into something else, and how fast it hits your bloodstream, that is better known when it's administered orally. The other thing that is better known is the pharmacodynamics, which is how it is broken down. Those two things, the pharmacokinetics and the pharmacodynamics, are better known because they've been studied more on orally ingested synthetic hormones than they have on different routes of delivery. So what this means is what is known is that your body produces different metabolites at different ratios, so at different concentrations, based on the route of delivery. So what is known is that if you're exposed to synthetic hormones through an intrauterine device as compared to taking those by mouth, your body is seeing different concentrations of different breakdown products of those synthetic hormones. But rest assured, your body, your bloodstream, your entire body is exposed to it regardless of the route of administration. A 2014 study published in the American College of Rheumatology found that women using hormonal IUDs may be at an increased risk for producing the autoantibodies, so again, the anti-nuclear antibodies, related to the development of rheumatoid arthritis. Number 5, serum amyloid P component, which is a protein found in amyloid plaques in people with Alzheimer's disease, is one more immune-related protein that's been found to be significantly higher in women who are using hormonal contraception. This particular protein, even though it's found in amyloid plaques, it's unclear what role it plays in Alzheimer's disease. So we just talked about quite a few. There are more. We've already covered 5. I want to mention one more in particular, at least one more in particular. Okay, 2 more in particular. Mean corpuscular volume. So this is MCV on your complete blood panel, on your complete blood count. So again, on your CBC panel. Mean corpuscular volume, again, MCV, is a measurement of the average size of your red blood cells. And this is moving beyond plasma. Okay, and that is 5 different things that will show up, that can show up in your blood results, and can change over time due to use of hormonal contraception. There's a lot of research regarding a woman's increased risk of contracting certain sexually transmitted diseases, sexually transmitted infections, while using hormonal contraception. But what's less clear is whether her risk is increased because of changes in her immunity, or whether it's due to physiological changes within her cervix that makes her more vulnerable to these sexually transmitted infections. So for that reason, that one's not included on the list. For now, this is plenty of food for thought. So we've talked about quite a few. Most of what we've talked about today are more specific, and they're ones that are less likely. They're quite frankly, the ones that are not going to show up on standard blood tests. This is when your doctor is looking for disease. This is when your doctor can't figure out what's going on with you and is running those additional tests. In all likelihood, the elevated amyloid protein is something that would not be run on you. So because you would have no reason for that to be run on you. Hopefully you're not developing Alzheimer's at a very young age. And some of these other ones are just not in a CBC panel, complete metabolic panel, or a lipid panel. They're more specific. Now, does this mean it always shows up? No. What we're talking about here is if you were to take your blood test results, let's say you happen to have any of these values that predate your use of hormonal contraceptives, and then after you've been on hormonal contraceptives for a while, have your doctor rerun one of these tests for some reason. I mean, here, you're not just going to walk into your doctor's office and ask for these tests to be run necessarily. There will be some underlying health condition or something that you suspect is going on, some reason for running these tests, in other words. What is likely to happen is that if you have lab results that predate your use of hormonal contraceptives, and then you have lab results after you started using hormonal contraceptives, you would see elevation in these. So whether that is those fibrinogen levels that we talked about, whether it's C-reactive protein or anti-nuclear antibodies, you would see elevation in those three markers. The other, the amyloid protein, that is one that likely will not be run. It's just, that is great knowledge. I think it's this is leading to informed consent on what you need to know as a human being taking hormonal contraceptives, that you are definitely running the risk of having that particular protein elevated in your body. And then the last one, those electrolyte balances, that would be something that you could see more easily. This would show up on your CBC and some of your normal blood work panels. So that is enough food for thought for today. Trying to keep this relatively short. Next time in this summer series, we're talking about how your red blood cell counts are impacted by the use of hormonal contraceptives. And this is one where bring along your CBC panel, definitely, because we'll be talking about values like MCV and MCH, that's mean corpuscular volume, mean corpuscular hemoglobin, and most importantly, why it matters when those are high. I walked around with high levels of both of those for years and asked my doctor several times what a high MCV meant and was dismissed and said, oh, don't worry about it. Turns out it's an indication of a specific type of anemia, and it was cause for concern. So anyways, we'll talk a little bit more about why it matters that those are high, and well, I've already spilled the beans there, how hormonal contraceptive is related to increasing those values and high. And in addition, we're talking about others as well. In the meantime, in case you want to do a direct comparison of your CBC panel, your complete metabolic panel, and or your lipid panel, and just look at how hormonal contraceptive impacts those results, click the link in show notes and sign up and claim your free guide. Just go ahead and download your free guide of how hormonal contraceptive affects every single value in those panels. Next time on the podcast, on Wednesday, May 17th, I'm releasing my interview with Mike Gaskins, the author of In the Name of the Pill. And this is all about the history of hormonal contraceptive approval by the FDA here in the US, and about what doctors knew way back in the 1960s regarding the horrible effects of hormonal contraceptive on the female body. So don't miss that episode. As always, thank you so much for listening. If you know someone who would enjoy today's episode, take a quick second and share this with them. If you know someone who has been really poring over and agonizing over their lab results and can't figure out what's going on, send this to them. They may very well be interested in that free guide. All right. Until next time. Bye.